world, Supersonics Money Transfer has got you covered. With the largest payout network in the Gambia, you can now receive your monies anywhere you are, from Kartong to Koina, with less hassle. Yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland and the rest of the world with our safe, secure, fast and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonics Money Transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.
Vaccine, vaccine, vaccine. They all get vaccinated.
Millions of people around the world don't get this vaccine here. Coronavirus not something we do. It not sabi race, it not sabi gender, it not sabi tribe. It don't kill thousands of Africans around the world because it not been get cure. But the good news now, it don't get vaccine. Coronavirus, not all man in business. So tell you people that where you like. On a member say, we all not safe till we all unsafe.
Penmore Physiotherapy and Rehabilitation Clinic is the first of its kind in the Gambia. We have inpatient service and outpatient services. Penmore admits patients and they have intensive rehabilitations. That means treatment 3 times a day for 5 days, from Mondays to Friday, and on Fridays they go to their families to spend time with them to have family. Our patients come on regular appointments, probably 2 or 3 times in a week for treatment. We treat patients with arthritis, with back pain, stroke patients, fractures or after fracture operation, paralysis of all types, and we do treat both young and old patients. Penmore Physiotherapy gives quality physiotherapy treatments to Gambians because we are qualified physios from different parts of the world.
Group, distinguished just from Edward Francis Moore Teaching Hospital, the media houses, APS, from our able MD, Mr. Juf, to my entire team. We would like to thank you all for the grace in this noble occasion. First of all, we will start with the opening prayer. اللهم اجعل جمعنا هذا جمعا مباركا وتفرقنا من بعده تفرقا مرحوما محبوبا. اللهم ألف بين قلوبنا وأصلح ذات بيننا وانصرنا على عدونا. اللهم من أرادنا وأراد أهلنا بسوء فرد كيده في نهوره برحمتك يا أرحم الراحمين. اللهم يسر لنا عملنا سبحان ربك رب العزة عما يصفون وسلام رب العالمين. We will now give we will now give floor to Mr. Keva Sanem, the PRO, to welcome the attendee.
On behalf of the Board of Directors of this institution, the management and the entire staff of Edward Francis Moore Teaching Hospital, we welcome APS. Regular donors to this wing of the hospital. We are very appreciative all the time of people who thought of us and decided to come to our aid in these very difficult times. Represented here are the department, the unit head, Madame Jaite, and then we have Dr. Charles Roberts here, the Deputy Chief Medical Director of this institution. And we also have a representative of, is it the infection control? Okay. We thank you very much, the media and everyone else who is present here today. The corona is not gone. You want to see my face? Okay, there we go. Yes, as usual, what happens is that this institution, like many other places in this country, we are expecting that we would meet all the needs, but unfortunately that's not the case. So obviously we welcome those philanthropists and all those international organizations and national organizations, individuals interested in helping our people. For this is the only referral hospital in the country, all over this country. Complicated cases that cannot be handled in other institutions or other clinics are brought to this place. So any help that is coming to Edward Francis Small Teaching Hospital is generally a help for the whole nation. We thank you very much, APS, for always remembering us and coming to our aid, particularly the new Gambians that are born here on daily basis. Thank you very much.
Kanifing and the MD from APS and your team. I would also like to join my voice to welcome you all to Edward Francis Small Teaching Hospital. As was said by the PRO, this is the main referral hospital in the country. So whatever help you are giving to this hospital, you are giving to the Gambia, to the nation of Gambia. And I think it is very fitting that you are concentrating on the maternity unit, because maternal and child health is very important, not only for this institution, but also for the nation. So any help that you give towards that, it will go a long way. And we acknowledge that, yes, the two institutions that you have chosen are the two main institutions in this country that deal with very severe and complicated cases. So we want to thank you very much for this gesture. And we hope that other institutions, other philanthropists will look at this and then also come and see how they can also contribute to help the nation of Gambia. So rather than people sitting back and criticizing our institutions, they should come in and find out what are the problems, what are the gaps, what are areas in which they can partner with us, and then partner with us and help to improve the health of this institution and the health of our Gambian populace. That is our ultimate aim. So we hope that people will learn from this gesture and then emulate this noble gesture. Thank you very much.
All protocol duly observed. I'm speaking on behalf of the CEO of Kanifing General Hospital. I would like to thank APS for this great gesture. Health is not cheap, and the government cannot do it all. If we have an organization that is coming to give a helping hand, we would like to say thank you. These gifts will go a long way in the management of our maternal patients. So thank you very much. So we appreciate all the gifts that are given to us today. And we will also like other organizations to emulate what you've done today for us. So on that note, I will just say thank you once again for the gesture.
Thank you, Sister
Bismillahirrahmanirrahim. Assalamu alaikum. I'd like to appreciate the presence of Dr. Roberts, the CMD of Edward Francis Small Teaching Hospital. Sister Kodo, thank you for coming on behalf of the CEO. Dr. Nyasi, Deputy Director, thank you for coming. Thank you for coming on behalf of the Honorable Minister of Health. We appreciate your presence. All other dignitaries present. The PRO for the warm welcome and helping us in coordinating this whole event. The media for the coverage. Our employees who have participated in this day up to today, the employees of the two hospitals we are working with today. We appreciate your presence and we are extremely glad of it. Please accept this modest donation from APS towards the welfare of our maternity patients, both in the Edward Francis Small Teaching Hospital as well as the Carnifing General Hospital. This is how we think we can give back to the community and the Gambians at large for supporting APS in our business endeavor. APS is the leading money transfer company to the Gambia over and above all the global brands we know about in this world. But that could only happen because of the sincere and loyal patronage of the Gambians who have been with this company since the beginning. So we thought it is fitting that from the bututs and the dollars we generate from the business, we should return part of it back to the community. And we wish we could go from house to house, person to person, and give them their own share. That would be difficult, but a donation to a facility where every Gambian is in need of in one way or the other, we thought that was more fitting, and that's why we are here today. This is a promise we have made to the Gambians, and inshallah, from today we have made this commitment that this will be repeated this year and next year this time, inshallah, because we have offered to make it an annual event. In addition to that, APS has also committed to work with our communities and our agents who are representing APS in various communities to take part of the transaction fee that our agents provide and set it aside as a pool, and at the same time continue to mobilize additional resources from our external customers to support all local health facilities across the country. So this donation we are seeing today will not be limited to these two general hospitals alone, but the smaller health facilities will also have their fair share across the country in the years to come. And this is a commitment we have promised the Gambians, and we will deliver on it, inshallah. On behalf of the board, the general management, and the staff, we want to thank the hospital for the excellent services they are rendering to the Gambians. As frontline health workers, we can all imagine how difficult it has been for you to leave the comforts of your house or your homes and come out in the front line and avail some critical services to the public under very, very difficult circumstances due to COVID. That we appreciate, and we want to express that appreciation to you on behalf of our customers and to the community that we serve. To our staff, APS staff, we want to recognize your relentless services in also offering critical financial services to the public during very, very difficult times. We have millions, thousands of Gambians rather, abroad supporting thousands of families back home under very difficult circumstances, but you have always placed yourself in the front line to make sure the funds that are remitted from different parts of the world reach their families on time and for the purpose it is meant for. Your efforts are well appreciated. This, like I said, will continue, and inshallah, we will come back here next time, this year next time, to present an honor donation. The total value of the donation we are handing over to the Edward Small Francis Teaching Hospital and Carnifing General Hospital is equal to $575,000. And like I said, this is our modest contribution. We wish we could do more, and inshallah, as we progress and do better in our business, we will increase the allocations. I want to thank you once more for your attendance, for your participation, and for welcoming us here. Thank you so much.
Deputy Chief Medical Director, Edward Francis Small Teaching Hospital, the able PRO of EFSTH, Mr. Sane, Sister Kodu, ably representing the Carnifing General Hospital, our colleagues from the media houses, my able department matron, Fatmata Jaite. Ladies and gentlemen, good afternoon to you all. Let me just take this opportunity also to join my colleagues here present from EFSTH and Carnifing to thank APS Financial Services. I want to say they are our true partners in need and indeed. I could remember some time ago, about a month or 2 months ago, I received a call, an email from one of their members requesting to support two of our main facilities, that EFSTH and Carnifing General Hospital maternity units. Okay, I was somehow reluctant because I was not taking it that they will do it so fast. So once a while I'll be receiving mails. I said, okay, these people are really serious. They want to support the Ministry of Health. So I gave it a second thought. So that was at the time I really started engaging with them vigorously to make sure that this thing occur. If you look at health, it's very expensive. With all the expenditure, the amount of money the government is spending to make sure that everybody have access to universal health care, is very expensive. And this is the only country that is making almost healthcare services free for everybody. Because with $25, you can easily have all the medication and the treatment if available. And the government cannot do it alone. So we need partners like APS to come and support us. So I will say thank you very much for that commitment. It is not our own initiative, it is not our own plan, and it is not our own request. It's something they sat down as a financial services and said, look, there is something we can contribute to for the development of this country. And their first point of thought is what? To make sure that health service delivery is improved. And they came up with this idea. So I want to take this opportunity to thank APS Financial Service for the commitment, hard work, and the foresight to make sure that they join us to make sure that we improve the healthcare of this country. I'm happy to also emphasize the same point that the Deputy CMD made here. You did not sit down and criticize us. With all the effort our health forces are doing to make sure that health care is provided to the needy people. But some people are just sitting down just to criticize without coming to the ministry or coming to the hospital to sit down and find out what are the problems, what are the solutions, where can we pop in to help. But they will just sit down in their offices, just make, negative criticism about the health sector. We are not saying that we can do it. We are perfect in whatever we are doing. But we are working day in, day and night to make sure that everybody have access to healthcare services in our best possible way. And that is what you've been seeing it from our nurses, our doctors, our laboratory service, our pharmacy technicians, and so on. And this is the support we need. What we are going to provide us today, at least, is going to help us to fix a negative gap that we are facing. We have so many challenges. And with the coming of APS to support us in adopting these two maternity wards, EFSTH and Carnifing General Hospital, will help us a long way to make sure that we sort out some of our challenges in the best positive way. And be rest assured that we are going to make sure that the support we are going to render to these two facilities will make sure that we support you to make sure that the material are used to benefit the needy people. So that is what we are going to do as leaders, and you have been seeing it. The commitment from the leadership of these two hospitals is very positive, and we are going to give you that assurance. So we are looking forward to seeing more positive collaborations between APS and these two facilities. Thank you very much.
Services, Dr. Lamin Nyasi, the Deputy Chief Medical Director, Edward Francis Small Teaching Hospital, Dr. Roberts, the PRO of Edward Francis Small Teaching Hospital, representative from Kanifing General Hospital, Sister Kodu, and the MD of APS, members of the press, my fellow colleagues, good afternoon to you all. On behalf of Edward Francis Small Teaching Hospital and Kanifing General Hospital, I want to express my sincere gratitude and appreciation to the APS because this is just, I don't know how I can even say it, because a lot of money transfer agencies are in the country, but I can say this is the first of its kind we have received as a department. And we really thank the APS for thinking about health and maternity in particular. Yes, a lot of people are saying that we have a lot of mortalities, maternal mortalities, but we are doing a lot of work here. We are saving a lot of lives. We are saving a lot of women as the main referral hospital. It would have been good if the people come around, they see what we are doing. But organizations like APS did not do those kind of things. APS could have also said, this is our profit, let us give it to our staffs as a yearly bonus, let them organize parties, or we do other things. But they said, no, let us give it back to the society, the people that are bringing their monies here. Like the MD rightly said, we cannot give it to everybody, each and everyone in the house. But if you give it to this EFSTH, Kanifing General Hospital, you are giving it to the entire Gambia. I bet you what you did is going back to the entire Gambia. So on that note, we really thank APS for being part of the solution and not being part of the problem. Yes, other people are talking a lot and they did not do anything for the health facilities. But APS has done a lot by coming this far to the health facilities and maternity in particular. And if you help a woman, you help the entire nation. So on that note, I say a big thank you to APS. Thank you.
Corona anga kele kuranja wonyimbe mulufakane nisirana corona nye alinga fantanka nye dunia kona alinga wale corona alimbenga kele kuranya dumbe mulufakane nisirana corona nye alinga fantanka nye dunia kona alinga wale ngamira nunga bantale yara fama damuta adon sifa jamale nata alinga kele kapo dunia aduna tanyame amandindilo aduna tanyame amankibalo aduna tanyame amamusuka fukilo mume vaccino nyina tale kandema vaccino nyina tale kandanga maxodu Nibe findila vaccinota ngafantanga fonse dagani kurabulu banani pana chukuba anganjanto nesirana coronavirus nye anga vaccinita La Covid-19 est toujours là, elle avait reculé pour mieux sauter, plus redoutable que jamais.
If you want to receive monies from UK, Europe, USA, Canada, Switzerland, and the rest of the world, Supersonic's money transfer has got you covered. With the largest payout network in the Gambia, you can now receive your monies anywhere you are, from Kartong to Koina, with less hassle. Yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland, and the rest of the world with our safe, secure, fast, and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonic's money transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.
Est-il vrai que le vaccin contre le coronavirus a été créé pour dépoper THR race noire? Il n'y a aucune preuve scientifique que le vaccin contre le coronavirus a été créé pour réduire la race noire, en particulier les Africains. En fait, cela vous aide à vous protéger du coronavirus. Alors, faites-vous vacciner, vous, votre famille et la société.
Penmore Physiotherapy and Rehabilitation Clinic is the first of its kind in the Gambia. We have inpatient and outpatient services. Penmore admits patients and they have intensive rehabilitations. That means treatment 3 times a day for 5 days, from Mondays to Friday, and on Fridays they go to their families to spend time with them to have family. Outpatients come on regular appointments, probably 2 or 3 times in a week for treatment. We treat patients with arthritis, with back pain, stroke patients, fractures or after fracture operation, paralysis of all types, and we do treat both young and old patients. Penmore Physiotherapy gives quality physiotherapy treatments to Gambians because we are qualified physios from different parts of the world.
Askan wi génn leen ñu pengu jee fagar lu moo gan fa jooyaay mooy li ñuy aar.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu. Mbokk yi ñuy seetaan, man la al ustaz Muhammadul Amin Kan al Mansouri. maa ngi leen di massaw ci feebaru mbas bii nga xam ne wër na àdduna bi, tëj na doomu aadama yi. ñu koy wax coronavirus ku ne xam na ne rey na doomu aadama yu bare bari ci àdduna bi. fekk am na ku ko am rek yëgal ne kenn muccagul. lu ciy pexe la ciy pexe mbokk moo di nga jóg gaaw léegi bi nga déggee sama kàddu dem jëli vaccine bi. comme vaccine am na, nañu sant yàlla te vacciné wu. dalalal sa xel nga dem jëli vaccine bi ndax nga aar sa bopp, aar sa njaboot, waaye aar ñeneen ñi nga dëkk ak ñi ngay jëflante.
Askan wi génn leen ñu pengu jee fagar lu moo gan fa jooyaay mooy li ñuy aar.